they should be concerned. This study, along with a considerable accumulating body of other studies, is showing that cannabis use is associated with a greater risk of psychosis and schizophrenia, as well as bipolar disorder, which similarly doubled in the population we saw, and about a one-third increase in depressive diagnoses and one-quarter increase in anxiety diagnoses. So this is very concerning. It means that pediatricians should be screening the young people that they're taking care of for cannabis use and advising them. And also, particularly for those young people who may already have mental health issues of depression or anxiety or psychosis, to help educate them that cannabis use can make these problems worse rather than helping treat them, because many young people are using cannabis to treat symptoms of stress or anxiety, believing that it's a safe, natural wellness product, which unfortunately it is not. It can be used for some medical conditions, but for these mental health conditions, the growing body of evidence is that it causes adverse effects rather than helps. Well, the brain is still developing, as pediatricians know, until your mid-20s. And it appears that the endocannabinoid system is particularly sensitive to exogenous cannabinoids, to being exposed to THC in particular from outside the body. THC is not naturally present in the body, but there are other, what we call endocannabinoids that are the reason why we have an endocannabinoid system in the first place. But if kids are using cannabis, it binds to these receptors and affects their physiology and seems to be having some long-lasting effects in some cases. Notably the changes in terms of psychosis, but people have also documented other types of changes in the nervous system in young people who use. Those changes are greatest the younger the person starts. Um, for our data on anxiety and depression, the association dropped off with age. As the children who reported using cannabis got older, we saw less of an association with increased anxiety and depression. However, the association that we saw with psychotic disorders and with bipolar disorder did not drop off with age. And this, one of the strengths of this study in particular was that it was a very large study with 463,000 young people, aged 13 through 17, and also that we excluded the existence of these diagnoses prior to the self-reported exposure to cannabis, because part of what we wanted to look at was the chicken and the egg question. There's a lot of discussion about whether the association between cannabis and these mental health effects is causal or a consequence of young people who have mental health disorders trying to treat themselves. And this study helps address that issue by showing what we call the pillar of temporality, that the exposure to cannabis was occurring prior to the increased risk of developing psychotic disorders or bipolar disorders or these other conditions. So that helps contribute to this debate about causality and cannabis in the direction of supporting that it may have a causative contribution. Can't actually absolutely establish it, but it's continuing to build that evidence that's growing rapidly that cannabis is playing a role in the increased risk. From between 8th and 12th grade, the rates of cannabis use go up pretty remarkably. So they're still low but present in middle schoolers and affecting a significant percentage of young people, about 10% um, of those 12 to 17 in the last national surveys. So certainly for your high school, your kids who are in high school, it's helpful and wise to screen them for cannabis use and have those discussions. In many places, it's going to be more widespread than tobacco use, which is not to say it should replace tobacco screening, but perhaps be integrated with your screening for other behavioral risk factors. And then I'd strongly encourage every pediatrician to be an advocate in their community as well. We now have 24, 25 with Virginia, states that have legalized the sale of cannabis. But most of our states have not put in place guardrails on those legal markets that can better protect our children and youth. So we have widespread sale of extremely potent cannabis products, vapes and concentrates that are 70, 80, 90, 95% THC, which have increased risks of being associated with psychosis. We have tons of packaging with pictures of astronauts and fruits and animals and cartoons and imitations of cereals, or they're called, apple fritter vapes, or strawberry banana or cherry pie or gelato ice cream. So we have a market that is very attractive to our children and young people that's causing both unintentional exposures and intentional use in teens and young people. And we have products that, as the market has become increasingly industrialized, they look a lot less like your traditional plant that most of us pediatricians may or may not have been exposed to in college rolling a joint, and a lot more like chemical extracts. It's something we saw in the opioid industry, the evolution from poppies to opium to codeine to eventually fentanyl, with chemical concentrates that are increasingly potent and having more serious effects. And we're seeing that in cannabis as well. Not as serious as fentanyl, of course, not as deadly as fentanyl, but because the use is so widespread, it's likely to have significant population health impact. I think there are those which are supporting the individual, screening of universal, supporting universal education of young people and families about cannabis and its risks, preventively, screening, brief intervention to educate people who are reporting use, and really referral to substance abuse and addiction counselors as early as possible for those that are using cannabis in significant or harmful ways. So the basic screening, brief intervention, referral to treatment paradigm that's been developed for other substance use also applies in the case of cannabis. And we'd encourage pediatric and family practitioners to try to find ways to integrate that growing risk factor into their practices. I mean, just to give an idea, today, if you look at young adults, 19 to 30, 1 in 10 is using cannabis every day. And that's more than quadrupled from decades past. So 1 in 10 of our young adults is walking around stoned every day. That's not good. And that is reflecting increasing use in adolescence. And that's carrying over, some of which is starting in young adulthood and some of which is carrying over from adolescence. I'd also strongly encourage the pediatric community to be advocates in their states and in their communities where they live for better cannabis policy, for putting into place the guardrails that we need to protect our children and youth from what is a very rapidly going industry, and an industry that's increasingly behaving like the tobacco industry did in terms of influencing children and youth to initiate cannabis use and marketing products that to them. So pediatricians are really important. Please speak up, speak out, be a voice in your community.